This is the Horse Radio Network.
This is episode 589 of the Dressage Radio Show, official podcast of the United States Dressage Federation on the Horse Radio Network, brought to you by ProStride. On tonight's show, we will be joined by Dr. Laura Stokes-Green, a practicing veterinarian who is coming on the show to discuss osteoarthritis in dressage horses. Then we have Grand Prix competitor Sarah Lockman on to chat all about riding corners. Our Total Saddle Fit trainer tip of the week will be with Bridgid Browne.
This is Reese Koffler-Stanfield from Georgetown, Kentucky.
And this is Philip Parks from Rockwood, Ontario, and you're listening to the Dressage Radio Show.
Hi, Phil.
Hi, Reese.
It's been quite an evening already.
We've been having some troubles today. That's okay.
Sometimes
Technical
it
issues
happens in podcasting. Yes, like horse training, not always perfect.
We're just doing our best every week, right?
That's all we can do, right? Yeah, we're laughing because some nights go just as smooth as can be, like a horse show. It's beautiful, it's fun, we have a great time. And then there's other where it's just not. You get a flat tire, your horse is wild. We're having one of those nights. But we are happy to be here with everybody. And how has your week been?
It's been fine. It's been fine. I've actually just been dealing with a little bit of neck pain, so. I need to schedule a massage or something for myself. We always say we take such good care of our horses. They've got their massages scheduled, they got their chiropractor scheduled, they got this, that, and I was searching through the cupboard before I came on the show to get some Advil to kind of. Anyways,
it is so true, actually, and it's funny though. But I will tell you, Phil. I started paying more attention to my personal health a couple years ago because I was having a lot of trouble with my back, and you had a fall pretty recently, so it's a bit different. But I will tell you, I started doing the DRT. I really got into yoga. It doesn't, I'm still have wear and tear. But in general, I do think I did also now I go to massage prior to COVID a lot. I went at least once a month. So I tried to actually be as good to my body as I was to the horses. And I also started to stretch a little bit more before I rode. And I will tell you, it really was helping me a lot.
Yeah. So I think these things are important, and, so that we can do our job as best as possible, and, and do the workouts and yeah. So yeah. This is what I'm thinking about today, and
I bet. Well, again, you had an injury. It's different when you have an injury, and that's a different thing. So, but in general, I think riders are terrible at that. And there's actually some good stuff online on just even how to stretch for 5 minutes before you ride, especially if you sit a lot. I've been grading a lot of papers recently, so yeah, I'm not good at, I'm pretty bad at, I'm actually now sitting in the chair a lot more than I normally would. So I understand now. I mean, 2 nights a week, I do my class on Monday nights, and we record on Thursday nights. So there's 2 nights where I'm sitting in an office chair, and I can see why people struggle along with driving to the barn. I'm getting the feel of it. So I've had to pay attention more to stretching. So I guess that's our tip of the week for sure before we get into anything.
Beginning of the show. Yeah. Take care of yourselves. Yeah.
Take care of yourself. But yeah, we've actually had a good week here. The weather's it was actually really, really warm the last couple of days. And it's been, for 2020, we have had a very beautiful fall here. The leaves have been gorgeous, and they still kind of continue, and that's been fun. The horses have been getting some good hill work because we know we're going to get locked in soon, and so we've been enjoying the hill work. Big Mike's been doing quite a lot of hill work because we're trying to get him strong, really, really strong for the FEI levels. So I don't know if he's enjoying it. I don't think that would be what, if you had to talk to Mike, I don't think he would say that, but really he's doing well, and kind of taking advantage. We're also, have I told you about our Friday yet?
No.
This is something super fun that we've been doing, and I just thought of it. So every Friday morning at 9:00, we go on a group ride. and we Phil knows my property, but we stay within the property, but we go all over. We go down to the creek and we go in the paddocks, and it has been so fun during COVID to do it. And sometimes we have a very big group, sometimes it's just a couple of us. Very big group. I don't have a huge barn, but there's been times where we've had a good number of the horses out. And it's actually been lovely. And so I would encourage everyone, if you can, with your barn team, get on and go outside for a ride. It's fun. We laugh. I can't tell you the horses are on the bit. They're not. We talk about what shows we've been watching and just laugh. And it's been a good therapy for all of us. And I tell you, the horses know, and they see us all get ready and they're like, it's Friday. So we're really enjoying it here in the farm. So
that's a great idea. That's awesome.
Yeah. So that's our other tip, but we're going to get to a show. We have a great show for you today. And I hope you enjoy our first guest, Dr. Laura Stokes-Green. Well, tonight we are very happy to have Dr. Laura Stokes-Green, veterinarian from Steele and Associates, on the program. Laura, welcome.
Hi. Thank you so much. I'm so excited to be here with you guys.
Well, we are going to talk about such a common problem with horses. It is, and as we age, osteoarthritis and joints comes into play. So can you just get us started about some comments you have about it?
Absolutely. So, one of the biggest things that I get called for is people saying to me, my horse just doesn't feel quite right. It's not that they're necessarily lame or limping. It's more of the movements just aren't quite as good as they should be. They're not as flexible. I feel a little bit to this direction. And what I do is come and do a soundness evaluation on each of these horses and flex each of the joints to look for osteoarthritis, because it's really one of the most common things. And so somewhere between the ages usually of 10 to 12 is when it starts, when I start to see the most effect from it. And then, as we know, a lot of our schoolmasters are in the 15 to 16 or older range. And those guys really are the ones that have the most osteoarthritis. And so my job is to figure out, first of all, which joints are affected, and then to choose the best strategies to try and manage them. Because a lot of this stuff, we all have wear and tear as we get older. And so a lot of it is coming up with the best program to make that osteoarthritis as minimal as possible, and also to have the least inflammation and pain as possible.
So maybe, Laura, we can start with a simple, as simple as you can, a definition of what is our osteoarthritis.
Sure. So osteoarthritis is when there is first synovitis, which is inflammation of the joint capsule itself. So the body, let's say, for example, the horse jumps up in the paddock and twists its ankle. And you come in and the horse has a big ankle and it's swollen and it's maybe a little tender on it, but it's not limping too much. This trauma can pull on the joint capsule, and that causes inflammation. And then what the body does in response to that inflammation is it releases a lot of inflammatory proteins. Some of them are called cytokines, and it will draw more fluid to the joint, which is what causes the swelling. And the reason for the fluid is it's actually trying to cushion the joint. So the idea that the body has is that the more fluid that's in there, the more of a cushion and lubricant will be available to that joint to make it more comfortable. But the problem with arthritis is that fluid then becomes very watery, and it doesn't have the proper concentration of the hyaluronic acid. And that's why when we're talking about hyaluronic acid and making the hyaluronic acid more concentrated, and we do that with Legend and Adequan and joint supplements that we feed them orally, we're trying to make that concentration of the hyaluronic acid within the joint the best quality as possible. So over time with osteoarthritis, you progress from a synovitis of inflammation of the joint capsule to actual bone change in the joint. And sometimes you can see this on X-ray where you get a little spur that comes off of the joint. It's the most common in my pre-purchases or my evaluations in coffin joints. That's like number one area that I'm looking at in these horses is coffin joint arthritis with a little spur that most people have seen before. And then when it gets significant enough and progresses through these stages, you can actually have rubbing of the cartilage, and the cartilage degrades on both sides of the joint. And when that happens and that cartilage is rubbed away, then you have bone on bone interaction. Each step that the horse takes, instead of having that nice clean cartilage layer that's a cushion and a barrier, you now have bone on bone. And people who have had knee problems before or skiing accidents that result in knee problems can relate to this, because that's how you get osteoarthritis in your knee, for example.
Yes, and I can tell you from personal experience that is very painful. So tell us, so obviously now you've done your Adequan, your Legend, and your supplements, and you still need some other options. So a really good option, obviously, is ProStride, because it's not going to hurt the joint long term. Or can you kind of explain that for us?
Sure. The most common joint injection, I would say, is probably your steroids and hyaluronic acid. And that's what a lot of people are familiar with. And that's where, if you think of a lot of the athletes that, like swimmers or football players, have gotten cortisone injections before. But the thing that we're really moving towards now is what we found is that the steroid actually long-term degrades the cartilage. It decreases the metabolism of the cartilage and is long-term detrimental. So while you might get a very strong anti-inflammatory good response from a steroid injection, over time, if you have to keep injecting that same joint with the steroids, it can be really creating more of an arthritic situation. And that's where we've turned to things like ProStride, which we consider a biologic, which means that it's coming from the horse's own body. So this is unique in that we draw the blood from the horse, and then we spin it down in a 2-part centrifuge process and concentrate the most anti-inflammatory and positive growth factor cytokines from the horse's blood. And then we use that, and you draw about 60 cc's of blood. And from that, you get about 4 cc's of ProStride. And that concentrated biologic anti-inflammatory is then injected into the joints. I have absolutely loved it as an alternative to steroids, or even as an adjunctive to my steroid programs, because I don't have that concern with injecting with ProStride that you're going to have the long-term detriments of the cartilage. And I also don't have some of the concerns that you get with the steroids, such as laminitis or decreased immune systems. Sometimes, I always tell people when I'm injecting what the risks are. And you just don't have the same level of risk with the ProStride that you have with the steroid.
So I know, Laura, you talked about this a little bit earlier, but how common is this in dressage horses specifically? And how can we prevent and help our horses? How can we get on this early to help them with this problem?
This, to me, is the most common thing that I deal with. My specialty is sports medicine, so it's really something that I'm doing every day, all day. I call it the bread and butter of my practice. We are looking for ways to always make the horses feel the most comfortable and perform their best. And the arthritis question is the biggest problem we deal with. So ways to prevent it, I think when I look at front feet, the number one thing I look at is the conformation of the foot and the way that the horse is landing on the ground and the shoeing. So I think that's, you could do a whole nother series of podcasts on shoeing, but it does contribute very much, because if you think about, if you were wearing a pair of sneakers that are high on the outside, and every time you take a step, you're a little bit high on the outside, it's definitely going to continue to affect. Those forces are going to go all the way up your leg. They'll go up to your ankle. They'll go up to your knee. It's the same thing with these horses, where every step they take, even from a young age, the conformation of the foot and the shoeing is so important. So that's something that I address first. And then once it's clear that they already have the osteoarthritis process, which again, it's probably, I would say, 90% of the horses that I'm looking at, even the young ones where we're doing the pre-purchases, they have some level of joint change. It might be so mild, but they do have an inclination that is in that joint. And then what we're doing is trying to constantly do these soundness exams where we have the horses on a routine of being checked, whether that's once a month, whether that's once a week. It really depends on the barn and the level of competition that the horse is in. I have some barns that I go to every week, and we just go through the list and go and watch them jog. And then if something looks a little bit amiss, I'll flex that leg, I'll flex that joint, I'll flex the whole horse to constantly keep a monitor on which of the areas need to be maintained and paid attention to. So if you notice, for example, swelling, you can never ice a horse too much, in my opinion. So for people at home who are asking questions, well, what can I do? Run your hands down your horse's legs every single day, or as much as the time as you're there. I think get really familiar with what your horse's specific anatomy looks like. So how much coffin joint effusion does it have? What do the hocks look like every day? How do the tendons and ligaments feel? It doesn't take very long. It's probably like a minute for you to just run your hands over their legs every day. And this is what a lot of people's grooms are doing as well. But it gives you that immediate familiarity when something is not quite right, or if something has a little bit of heat, to jump on it quickly and early. And if you can get some anti-inflammatory in there, and obviously this is always predicated by call your vet to discuss it. But when my clients call me and say, okay, I have a little bit of heat and a little bit of swelling, I am looking at cold therapy, so icing, cold hosing, and I'm looking at a little bit of anti-inflammatory like Banamine, for example. And then I'm looking at using a topical such as Surpass, which is another anti-inflammatory, so you have to be careful with drug rules with that. The ones that you can use that don't have medication in them that test are Traumeel gel, which is an arnica gel, which is excellent for any kind of contusion or swelling. So, that's part of the management of these situations. And then I love Adequan and Legend. I just think they're wonderful products. And then once you get to the point where your vet comes and says, hey, I think you need to treat this because the horse is offloading from the leg, let's say the left front foot, it's uncomfortable in the left front foot. And so the horse is now leaning too much into the right front foot. That's really when I like to choose which of the injectable solutions I'm going to use. And we have barns that they won't even let me near the horses with steroid after the programs that we've put them on. And we really are using only ProStride. I think that it depends a little bit on what the job of the horse is, what the age of the horse is. I like to use ProStride much more in the younger horses because I don't think you should be putting too much steroid in these really young horses. It doesn't sit well with me, especially since so many of our dressage horses are older. And then you're really trying to make the decision about, does it need to have something as aggressive as a joint injection, or can you manage it with more topical therapy?
So, Laura, you have some scenarios for us to kind of go through of what a common scenario would be, right?
Yeah. What I was thinking was, what are the common things that people run into, right? And so I think this is a story that's familiar to all of us, right? Imagine that you have been training with your horse. It's 16 years old. It's Grand Prix level. You've been training for months for this very important show. You're really excited about the horse is at its top condition. And then all of a sudden, 2 weeks prior to the show, you notice that the stride isn't as good. The movements aren't as fluid. Every once in a while, he maybe takes a bad step and a turn. And then you say, okay, I'm going to ice it. I'm going to pay attention and do my topicals. And then the next day, all of a sudden the horse is limping and it's a 1 out of 5, which is the lowest level of limping in the AAP grade, but it's definitely a level that you would see. So you call your vet and through the evaluation and the diagnostics, you realize that it's that chronic coffin joint again, right? And these coffin joints are, again, the most common area of arthritis that we deal with. But your vet just injected that coffin joint 2 months ago with steroid, and you're sitting there and going, okay, well, what do we do, right? We have this wonderful sequence of this show that we're going for, and we are really excited about it. We're in our top form. And that, to me, is your perfect position to use ProStride, because I am not worried that you're going to degrade the joint by using the ProStride, it's the horse's own natural anti-inflammatories. It's their own growth factors, and you can put that solution very easily in there. And then what's nice also is you're not masking anything. If it's something that's just a little bit of inflammation from the joint, then the ProStride will take care of it and you will have that sound horse. And if it's something that's more significant, the ProStride is not going to give you a level of soundness that you wouldn't otherwise have. Does that make sense?
Yeah, absolutely. It's like you're treating the problem, and hopefully you can get through it, and you're not adding more issues or, like you said, masking the issue. With NSAIDs and things like that isn't going to give you a false sense of, okay, the horse is fine now, and after the show, well, it's going to be terrible. Like, I think that's a really good use of this treatment.
Yeah, that brings me to another case example that I actually consider a mistake. And it's not often that you hear vets say that. So pay attention to this one. There was a very heavy boned older horse that I was managing, and we knew it had thickened suspensory branches. We knew it had arthritis in the fetlock joints. It was bilateral in front. And it had that characteristic onion shape of the ankle that you get when you have that suspensory fill and that suspensory thickening. And we'd been managing it, with a regimen of once a month shock waves. We had the wide branch suspensory shoes, and I was checking it very regularly in soundness exams just to make sure that he was doing well. And then probably, I would say, a year into that management program, he started to have more problems in one of the soundness exams that I did, and he flexed very strongly to his ankles. And I ultrasounded his suspensories. They looked pretty much the same as I had been seeing them, which was modeled, but no tears. And I x-rayed his ankles, and he did have changes in his fetlock joints, which showed me very clearly that he had osteoarthritis. So I chose at that point to inject him with HA and steroid, which is a pretty standard therapy for ankle arthritis. And this was actually before ProStride was available, which makes me feel better about this whole thing, because what happened is I injected those ankles, and the owner called me and goes, "Oh my gosh, she feels amazing." And then the week after, it's like he's a new horse again. And then they took him to the show. And when they went to the show, he did amazingly well in the show. And then the moment he came back from the show, she calls me and she goes, "He's crippled." And I went and checked him out. And what had happened was he had, through the showing, because he felt so good, he had actually then torn one of those suspensory branches. And on the ultrasound, I could now see very different ultrasound pattern than what I had seen previously. And I think this is a really good example where if I had done that with ProStride, I would have much less risk of making him feel so good from the steroid and masking that kind of soft tissue pain than the steroid gave. So I now really use, especially with horses where I have these complicated multifactorial lameness issues or maintenance issues, I use the ProStride a lot for horses in ankles or even hocks where I'm questioning the suspensory, because I know that I'm not going to push them over the edge and have them feel so good that they'll damage that suspensory.
Well, that makes total sense. So Dr. Laura Stokes-Green, tell us a little bit about your practice.
It is an absolutely amazing practice. Our practice is founded by Dr. John Steele, who imbued in each of us these really strong tenets of work ethic and the idea that the issues that we see in the horse are whole horse problems. So he really wanted us to look not just at the leg where the horse is limping or at the heavy breathing or at the metabolic issue. He wanted us always to look at the whole picture. So when I go over the horse, I'm flexing everything, even if it's not the most apparent problem, because so often you have these imbalances that come from the right hind that push the horse into the left front, for example. So that was one of the things about this practice that I loved. And we practice all over. So I am in the tri-state area. I work in New York, New Jersey, and Connecticut during the summers and the spring. And then in the winter, I go down to Wellington, Florida, and the other partners in the practice, Tim Ober is in Virginia, Melissa Welker is in Florida and Kentucky, Jim Mitchell is in New Jersey, and Peggy Giuseppe is in upstate New York. And so the vast majority of us go down to Florida during the winter. But I love is that we are all trained by Dr. Steele, and we all are able to cover each other in terms of the horses that are in the different areas. So I feel really good about having a wide reach for our equine competitors in a number of different fields, and then also being able to manage them when they're in Wellington, Florida.
Fantastic. Well, how can our listeners find you online? So
if the listener wants to email me, you can reach me at stokesgreendvm@gmail.com. That's STOKESGREENEDVM@gmail.com. And if you want to follow us on Instagram, it's at Dr. Laura SG. We'd love to hear any questions that you have. And I'm always interested in what people are concerned with right now in terms of their horses.
Dr. Laura Stokes-Green, thanks so much for coming on the show. Well, Phil, as you know, Kentucky Performance Products is a company that I love. I've been using their products for many, many years. Not only are they great sponsors of the radio show, but they're great sponsors of my own personal horses. And I will tell you, it's amazing. Our weather has been going up and down and all around, and we use their electrolytes. And just really all of their products are great. I have some horses that are, have some really bad insulin resistance, and insulin-wise products been a lifesaver on those horses. And all of their products, their joint-wise, their metabolism, we use all their products here, and my horses just look great. And I can't thank them enough. So we're going to have a commercial break from Kentucky Performance Products.
Vitamin E is a powerful antioxidant that supports healthy muscle and nerve function by limiting cellular damage. Green grass is the best source of vitamin E for horses, but most horses don't spend enough time grazing to meet their needs. Hay, grain, and winter pasture provide little to no natural vitamin E. To ensure your horse's vitamin E requirements are met, choose Elevate. Elevate contains a readily available source of natural vitamin E. Elevate is cost-effective and easy to feed. To learn more about Elevate, visit the Kentucky Performance Products website at kppusa.com.
I'm just going to take a quick moment to talk about the Eco Gold Comatec pad. This is gentle, soothing relief for sensitive horses. Eco Gold's Comatec saddle pad is made with medical fleece, which reduces friction and pressure points of contact. It's going to dissipate moisture away from the skin to alleviate discomfort and prevent irritation. It's also shimmable, so you can adjust the thickness. Shop the entire collection of saddle pads at ecogold.ca.
Well, tonight we are so excited to have Sarah Lockman on the program. She's the 2019 Pan American gold medalist. She's based out of Summit Farm in Murrieta, California. Sarah, welcome back to the show.
Hi, guys. Thank you. Thanks for having me back on.
Well, I've been watching your Facebook, and we're going to come up because we've got a great tip from you. I saw it and I wanted to get it on the show, but I wanted a quick check-in. How have you and Apple been doing and all your horses during quarantine?
I think that quarantine it's been crazy on a personal level and as a human being, but I think it was a blessing in disguise for a lot of us horse people, because it meant more time to spend at the barn and more focused time. So Apple and I have been spending our time that we have not been in the competition ring training and making details and things better and more fit and strong. So it's actually been a very busy, productive summer.
That's fantastic. Yeah, I think we've all enjoyed, our time at the barn for sure. I think I personally have loved it. And I'm like, now that I'm back getting busier again, I'm thinking, oh no, I like that time when I was with my horses. It was so nice. Well, Sarah, you had a great exercise. We always talk about on this show, and also teaching about riding good corners, ride your corners. But you had cones in the corners, and I wanted to talk about the exercise you were doing and why you were doing that exercise.
So one of the things that I have been doing, thanks to Amazon for those beautiful orange cones, is working on the details. This time that we've had out of the show ring, or at least some of the time out of the show ring, it has been wonderful to try squeeze another point or two out of those tests that we have to ride. And one of the things that I think is so important for us to remember, and it seems so simple, we do ride every day in a rectangle. So there are 4 corners in that ring that we should be riding. So I actually took the initiative and have started to use Amazon cones in the corner for some of the other details in the test to help with geometry. And so corners are a form, I like to kind of say, of geometry. So when you go through a corner, depending on what happens, will tell you a lot about what is happening with your horse's balance, with your position, with your horse's body, its alignment. So the corners are such an important part of our daily training. And the corners are obviously, when you look at any test at any level, you generally have a corner before you start any movement. So that is your start and most of the time your finish of movements. So even though when you look at the directives of one of those dressage tests or the movements in the tests as they're written out, they never say corners, but when you talk to any judge, they are watching you ride those corners, and it tells them a lot about either what is about to happen or what has already happened and how you fix it or move on from one movement to the other. So been riding with those Amazon cones in the corner, and some of it has been very educational. I've definitely laughed a lot. Cones have gone flying. I ride a lot of horses, anything from, my 4-year-olds all the way up to the Grand Prix horses. So I think it's a really good exercise, very simple to put a small orange cone, any color cone, in the corners and really test yourself and ask yourself, are you riding those corners correctly? And end up using those corners for your benefit as either a setup or a rebalance as you go from one movement to the next in a test.
Yeah, I like this point a lot, and I think that in a lot of cases with myself and with students that I'm teaching, it sometimes you just get going along, and then these corners are just kind of happening because they're there because you have to turn, and that is really not a great way to help your horse and to help your training. I think and depending on the horse, you have to ride the corner a little bit differently. Like you said, you ride a lot of horses at different levels, but you have to have a purpose for your corner, not just letting it happen. And there has to be a thought process around it, because you can, if you have a horse that drifts left instead of right, then you're gonna make more preparation as you're on the left rein, for instance, to really think about setting the horse, making a half halt and pushing the horse away from your inside leg through that corner. But if you have a horse that drifts out instead of in on a corner, then maybe you're going to need to use a little more outside rein and outside leg. It's just, and if you don't know what to do, then you can't do it, right? And so, I like to make the corners a transition for the younger horses to say, okay, I'm going to trot along, then I'm going to walk my corner, then I'm going to trot out, or as a way of refreshing the horse, I'm going to ride a little extra forward through the corner and then set them back as they come out. I think, you can ride them a billion different ways, but you have to have a plan. And I think that's super important.
Yes, exactly. And as as you climb through the levels, it's, especially in a Grand Prix test, I mean, sometimes the corner is all you have as a recovery and a preparation for your next movement. So I think it's important when I'm teaching and especially when I'm building horses, up from being young horses, that you don't let those little details like the corner that sound like little details go in the beginning, because as you climb the levels, it can't all of a sudden be an important part, and you feel like you almost have to retrain yourself as well to ride those corners correctly. So I think it's really important, even though I have to say on the young horses it feels a little like pole bending sometimes. It's still important to start that in the corners and riding them in a correct way. It's a great place to add in a half halt to check the bend and flexion. It's again, there's a reason why we were put in a rectangle, and it's obviously not the easiest shape to ride. But going from a straightaway into a bend into another straightaway, it sounds really easy on paper, but when you start doing it really correctly and at the right moment, it can be difficult. So I think it's really important that those kind of details don't get left out. And everybody that's taking a little bit of time this fall, winter as the show ring, it's such a simple thing you can do by yourself, and it's very telling. And like you said, it can really spell out a horse's alignment or a rider's alignment problems. And, it's not saying that you're going to use the corner to fix those problems, but it will bring it to your attention, and you maybe can go on a circle, fix what you were feeling, and go back and ride the corner. And it's such a useful tool, and it should be something that we're doing all the time. And I think we've all watched amazing tests, like Stefan. If you really watch Stefan, it is amazing how that man uses every corner, and for different reasons. Like you said, sometimes he's collecting, sometimes he's bringing the horse down and more through, he's riding forward through a corner. So there's so many things you can do. And I think now with technology, it's a great time for all of us to watch some videos and watch some of the top riders ride those corners and see how they use them to influence the horse and influence the next movement that they're about to execute.
And Sarah, I love, again, the cones are such a good visual, but one of the things that I see sometimes when I'm traveling around is, because of the way we drag arenas, a lot of times the footing in the corners, if you don't pay attention, the footing is not good there. So I know when you go into an arena, if someone's riding into their corners or not, because of sometimes how it's drug. And I think that's something to just kind of throw that out there. Have you guys seen that a lot in different places?
Oh, of course. Yeah. I mean, that's, like you said, it's pretty telling, but it's also, good arena management to be pulling the dirt. I mean, no matter what, the sand gets, it just drifts into the corners, and then all of a sudden you have this bank, and then you can't ride them because you don't want to change the footing of on the horse to go, up a hill and then down a hill into a corner. So, again, part of arena management is pulling the dirt out of the corner and making it flat so that so you have stable footing throughout the whole place.
Mm-hmm. I think we've all had a rake and done that.
Yeah.
Exactly.
Every
exactly.
week.
And one of the reasons the cones got brought out, we do drag completely through the arena, take the rails out every other day. But on the in-between days, my coach that was watching me ride said, get your horse, you need to get where the tire marks are, where the tractor couldn't get to. And that was pretty difficult even with that visual. So then that's when the Amazon cones came out. And those little orange cones, man, they're going to be the death of me, but I will ride good corners. So it is very important to make sure you're maintained correctly, especially when you start riding into known corners.
Yeah, I love it. Well, Sarah, thank you so much for your time tonight and your tip. It's a fantastic tip. I love it. How can our listeners find you online?
I have a website. You can find me at www.sldressage.com. You can also find me on social media. As you all know, I love that. Facebook and Instagram. Instagram handle is sldressage. And you can find me at Sarah Lockman on Facebook. And you guys know I am now accepting dates for clinics. So if you guys want to hear more of those tips in person or get some one-on-one help, feel free to reach out to me, as I'm able to do clinics and virtual teaching, especially while I'm down in Florida for season. And if anyone is looking for that schoolmaster that'll help you really how to ride a good corner, I've got some great FEI schoolmasters that are currently for sale. This is my website as well. And thank you again to you guys for having me on this podcast. I absolutely love being able to share knowledge, and I think it's great what you guys do for our dressage community.
Oh, thanks, Sarah. We're excited. We look forward to hearing and touching base with you this winter.
Thanks so much.
Tired of having your boot sucked off mid-stride by sticky mud? Mud control grids are the solution. Frustrated by mushy, slippery messes at the paddock gates? Mud control grids are the solution. Is keeping the ground underfoot stable in your sacrifice areas and dry lots causing you to lose sleep? Once again, mud control grids are the solution. You're seeing a trend here, aren't you? Well, Han Plastics Mud Control Grids really has come up with the best solution. Unlike other plastic grids on the market, mud control grids can be installed directly on top of the mud. Let me say that again. Right on top of the mud. You don't need to do any ground preparation. The mud control grids are an instant solution to your high-traffic, muddy areas. No more having to fill in with sand, gravel, shavings, or even old carpet. What's more, Mud control grids will allow grass to grow underneath of them, so they can be taken back up once the area is dry or recovered. Or you can leave them right where they are and take over again when the rainy season comes back around. Han Plastic's mud control grids are designed to be installed as a temporary or permanent solution. You can take them with you move. Put down a lot, put down a few. Add more each year. The ultimate mud control solution. Check out Han Plastic's mud control grids at mudgrid.ca. Oh, an added bonus, your tractor or gator won't sink up to its axles with Han Plastic's mud control grids in place. So there's that. www.mudgrid.ca.
Well, Phil, it is almost time for No Stirrup November.
I kind of had a sense that you were going to say that.
Yeah, you knew it was coming. However, with my Total Saddle Fit Stability Stirrup Leathers, I don't really want to do No Stirrup November. I'm not lying. I don't want to give up my stirrup leathers. Not doing it.
You know, I have to be honest. Like, November is not a good time to not have your stirrups here in Canada. I don't know if people know that. Like, you can do no stirrup June, July, August, even September.
Yeah.
October, November? No, thank you. That's
not a good idea.
We haven't had snow yet, but snow is coming and ice is coming, and I haven't clipped my horses yet. So okay, November's gonna happen.
Yeah.
I'm gonna clip the horses, and it's gonna start snowing, and I'm gonna take my stirrups away.
No.
So I'm gonna keep the Total Saddle Fit Stability Stirrup Leathers on my saddles, and
I'm with you.
I think that's going to be fine.
They're too great to take off, honestly. Like, without them, I like them so much. They're not coming off my saddles. I'm keeping them. They're really fantastic product. All kidding aside, seriously, Phil and I use these stirrups every day, every horse. I literally went through the barn and made sure everybody had them because I was like, this is too good of a product. And it gives you, why not take a little bit of help in any way we can? Yeah. So,
more comfortable and a more stable leg. That's what we all want anyway. So, you should look into getting them. TotalSaddleFit.com. They got a lot of other great products there that you should check out. Girths and saddle pads and lots of great stuff. So, we have to thank them for being a sponsor for so long on our show.
Yeah, we really, and all their other products too, we really appreciate it. And we have a fantastic Total Saddle Fit tip of the week from Bridgid Browne.
This week's dressage training tip is brought to you by Total Saddle Fit, home of the shoulder relief girth at TotalSaddleFit.com.
Well, I'm very excited to have for our Total Saddle Fit tip of the week, Bridgid Browne. She is currently in Germany training with Dorothy Schneider. Bridgid, welcome back to the show.
Hi, thank you so much for having me.
Well, we know you have a great Total Saddle Fit trainer tip of the week for us. What you got?
So something that Dorothy always tells all of the riders here is to positively influence the horse's rhythm by making a rhythm with your seat.
Fantastic. So elaborate for us.
Yeah.
So this means that in the trot, for example, to help to influence your horse to have swing and cadence by swinging with your hip in the rhythm. And then the same goes for the canter. If your horse tends to maybe have be behind the rhythm or to have a 4-beat canter rather than a 3-beat canter, you can help influence this through really feeling the rhythm through your seat bones into the saddle and helping encourage the horse along. She always says, show them the way.
I love that.
Yeah, I think that's really important for riders to have their own sense of tempo and their own sense of a metronome so that they can influence. Like, the horses aren't, I don't know very many that have a very natural, perfect, tempo in their trot, walk, and canter. So riders have to kind of know what to do with what they've got, right? If you have a horse that has a very quick tempo, then you're going to want to just sit an extra millisecond and stay out of the saddle an extra millisecond in a trot, in rising trot, for instance. So the horse looks to the rider for that confidence and that good rhythm.
Yes, exactly. And she also tells us to keep your body tension through the rhythm. Just like you said, if a horse has too high of a tempo, you can keep your body tension to slow the rhythm down through your seat.
Well, I think the idea is really good too. I know some people, like let's say maybe you're not gifted at that, or you have some, you need some help. There's some great apps, actually, some metronome apps you can get on your phone, or you can even pull out. There is an actual thing called a metronome, and you can pull it out. And actually that can help a lot of people, which is quite cool.
Yes, I actually used to play music. So I think that's a little part of my history that helps me a little bit with my riding.
Oh, I love to play music when I ride. I love it. I think the horses love it. I love it. Kind of gets me in the groove. I really enjoy that. So I think that's a fantastic tip, Bridgid. Really, really good. Well, Bridgid, if anybody wants to get in touch with you or hear about your adventure in Germany, how can they do that?
Yeah, feel free to friend me on Facebook or to follow me on Instagram at b.e.brownie.
Well, thanks so much. And we can't wait to keep following you.
Thank you for having me. Have a good one.
Well, as always, we love email and Facebook shout outs. They are so fantastic. They're super fun. We also really enjoy the Horse Radio Network Auditor page. The Auditor program is a way that you can help us with our programming. And that is also an amazing Facebook page. So we really appreciate all the love we get in there as well. And keep coming. We've had a long show tonight, which we've enjoyed every second of. And so we will get to some more email and Facebook questions, but keep coming. We love it. You can find our show notes and links to today's guests on our website, dressageradio.com. Like us on Facebook, just search Dressage Radio Show. Follow us on Twitter at Horse Radio. My website is maplecrestfarmky.com, and my email is reese@horseradionetwork.com.
The best way to find me is probably on Facebook, or my email is philip@horseradionetwork.com. I'd like to thank our sponsors tonight for allowing us to put on a good show. That's ProStride, Kentucky Performance Products, Total Saddle Fit, Han Plastics, and Eco Gold. Don't forget to check out all the other shows on the Horse Radio Network at horseradionetwork.com.
Everybody, keep your heels down, your shoulders back. Enjoy the Western Dressage program next week, and we will be back the week after to provide another great show for everybody. Thanks for listening.